I think that it was discussed that how much allocation in federal budget we get for health care. It was 0.9%, sir, until very recently when it was raised to 1.4% and then now 2.4%, which is supposed to be a very quantum jump in terms of healthcare spending by the federal government. But let's compare. Even with Latin American countries have a better GDP portion going to the health. USA, where the healthcare is in private sector quite a lot, still the government spends about 14% of our GDP in USA. Most of Europe spends ranging from 6% to 10-12% of the GDP on healthcare. In India, we spend 3% of our GDP on trauma care alone, whether we like it or not, whether we want it or not. People are spending from their pocket. It is one of the commonest reasons for rural indebtedness in India, the cost of care for trauma. If I have a heart disease, I may decide not to get treated. Maybe I'll die. But if you sustain trauma, you cannot wait. If you have a broken bone, it needs to be fixed. You have to get it treated, and that is what leads to indebtedness. We have to develop a mechanism where our large population is not devoid of the advantages of the development taking place in tertiary care facilities in the urban areas. We have to make these facilities affordable and accessible and not limited to one institution or two institutions. So we have to find a middle mechanism. We have to find where no-profit hospitals come up in larger numbers with the same quality what can be given. And there is an acute need for that, and there is a mechanism it can be done. We have some hospital in the South India I have seen. It is possible to develop that kind of healthcare in India.